Shall we then move rapidly? Simon, Chief Executive's report.
Thank you, Malcolm. So, as you say, we've got a lot on the agenda, so I'm going to be very concise. My report principally records the range of external-facing activities which I and a number of colleagues have been engaged in since our last meeting. I do just want to mention four things specifically. The first is to record my thanks and our thanks to Ed and to Paul and to Karen and their teams for the successful production of our annual report and annual accounts, which were laid before Parliament this week. And I think the way in which they've been conducted, the efficiency with which that process has worked this year, is a testament to not only enormous effort but a great improvement in the processes that underpin the financial reporting. And so thanks particularly to Paul and Karen and Ed as chair of our audit committee. Secondly, to report that substantial work underway across NHS England, Paul, Barbara, others, together with their opposite numbers monitor and TDA, in respect of the financial position of the National Health Service this year, and in particular the efforts that we described at our last board meeting to ensure that CCGs are funding appropriate volumes of emergency and elective activity in providers. That process, I think, has now worked its way through, and in addition, a lot will hinge on the effective execution of the cost takeouts on temporary staffing that providers are now engaged in. Monitor and TDA setting a dial back on the use of off-framework contracts, the hourly rates, the provider-specific totals, and frankly that is going to be the single biggest contribution to reducing the projected provider overspends this year. Alongside that, there are also controls on the use of management consultancy spending. The extra commissioned volumes need to be reflected in provider plans, and Monitor and TDA have signalled that they are in the process of agreeing financial totals with each provider in the country to ensure that overall the performance is substantially better than that which was being reported at the beginning of the financial year. So most of the executional responsibilities for that sitting with Monitor and TDA, but very significant stakes for the whole NHS, ensuring that that is delivered effectively. Thirdly, the Chancellor has announced that the spending review will conclude on November 25th. So now work gearing up between ourselves, the Department of Health and others to ensure that as we think about the phasing of the extra investment that the forward view requires, together with the refining of the components that will drive the efficiency that we seek to secure, the aim is that there will be substantial engagement across the front line of the National Health Service now through early autumn, putting flesh on the bones of what that efficiency deliverable will look like, so that at the same time as the spending review investment totals are announced, we're also able to set out clearly what the composition of the efficiency will be and its phasing and the who does what piece, recognising that there are three parts to that. There will be things that individual organisations across the NHS will need to do. There are things that the providers and commissioning bodies collectively will need to do, and there are things that only nationally can be done either by the ALBs or the Department of Health. And then the fourth thing I would say is that there are some important developments on our service redesign agenda. Bruce, I think, will talk about the important work of the Independent Cancer Task Force that has just been released. He has also been heavily engaged in the process on shaping the 7-day services agenda, and I think it's worth recording, given the public discussion that there has been on 7-day services, that, as I say in my paper, we need to distinguish the three separate problems that we're trying to solve here. And part of the where this debate goes off track is when people get these three issues mixed up. First up is the question of the excess mortality for hospital inpatients on a weekend that Bruce and colleagues have documented and reaffirmed. Second is the question of ensuring that there is readily accessible urgent and emergency care at evenings and weekends, as well as during weekdays out of hospital. And then third is ensuring that to the greatest extent possible, convenient, routine out-of-hospital care, primary care is available for people who can't get to it during the normal working week. And so we've got to think of it in those three buckets, three different solution sets. The response to the first and the second in part relates to the urgent and emergency care review, which we've previously discussed. And so the final piece I wanted to mention is that tomorrow we will be announcing the outcome of the urgent and emergency care Vanguard process. Same sort of process as has been used for the selection of the first 29. We'll be having a paper later on about the Vanguard support process. But these 8 parts of the country, which we'll be announcing tomorrow, are the people who are going to put their foot on the pedal in terms of fast forwarding the urgent emergency care review implementation so that we can actually see in practice how that delivers us the efficiency and the patient quality and access benefits which are implicit in Bruce and Keith's review. Those were the 4 points I wanted to highlight, Malcolm.
Thank you very much. Can I invite any comments or questions to Chief Executive? No? Thank you very much.